Exercise could play a key role in the treatment of certain cancers. A new study in the New England Journal of Medicine found colon cancer patients who took part in an exercise program with a trainer had a 37% lower risk of death after 8 years. Their cancer was also less likely to come back. And in another trial, it compared high fiber and lower fiber diets in melanoma patients starting immunotherapy. Around 77% of those on the high fiber diet responded to their treatment compared to just 29% in a control group. Dr. Jennifer McQuade was a senior researcher on that melanoma trial. She's an assistant professor of melanoma medical oncology at the University of Texas MD Anderson Cancer Center. Good morning, doctor. Thanks for being with us and joining us to talk about this. Help us understand that link between what people eat, what they might be eating right now, and cancer.
Sure, absolutely. So we've known for, years that that a healthy diet can dramatically decrease the risk of many cancers. However, the question has always been, what about patients that have cancer? Could improving their lifestyle, diet, or exercise actually synergize with their treatment and help improve outcomes? And this link really comes for the high fiber diet in terms of the gut microbiome. So those trillions of bacteria that live on us and in us. The microbiome has previously been shown to actually influence response to immunotherapy. And the bacteria that are associated with improved response are actually those that help us break down fiber, which we otherwise cannot digest. So we had shown that those patients that were habitually consuming a high fiber diet tended to have improved response to immunotherapy, and that if we manipulate fiber in mice, that we can improve response to immunotherapy. And so what we did is we actually conducted what's called a controlled feeding study, where we actually gave patients from our metabolic kitchen every single snack and meal that went into their mouth for up to 10 weeks, as they were starting immunotherapy. And this is a small study. So this is only 43 patients randomized to either the high fiber or the controlled diet. But we saw, not just the changes in the microbiome and the metabolome, but a marked improvement in the rate of tumor shrinkage in those that receive the high fiber diet.
Wow, yet another plus in the column of having a high fiber diet. Looking at the study on exercise and colon cancer treatment now, I'm wondering what stands out to you most about those findings.
I mean, so that study, I have to just congratulate the investigators. So this is 889 patients across 50 centers. This is a phase 3 randomized study. So they basically did a structured exercise intervention. This is in patients that had colorectal cancer, finished their chemotherapy, and then were randomized to either the structured exercise intervention versus just given handouts on a healthy lifestyle. And at 8-year follow-up, they actually see a 28% decrease in the risk of cancer recurrence and a 37% decreased risk in death. So this is comparable to what we might see for a new drug that would get approval. And this absolutely means that we need, the resources and insurance coverage and, health coaches to be able to offer this to patients.
Really encouraging findings. We only have a few seconds left with you, but I'm wondering if these findings could impact the way cancers are treated, perhaps.
Well, so again, this is, it doesn't take the place of the chemotherapy or of the immunotherapy, but it should absolutely impact the way that we work with patients to help give them tools to help improve their outcomes.
So useful, this information. I hope folks look into your study and the other study as well. Dr. Jennifer McQuade, we appreciate you joining us.
Absolutely. Thanks so